I rise for two reasons. Number one, I would like to make a motion to have my name removed as a co-sponsor of Senate Bill 693.
So ordered. Sorry.
Number two, I rise in strong opposition to Senate Bill 693. My original co-sponsorship commitment was predicated on the understanding that this bill would provide a free market alternative to the federal Affordable Care Act. As a co-sponsor, I had worked hard to ensure that this bill would live up to this promise. My concerns have not been addressed in this version of the bill, and I have read it thoroughly. Rather than serving as a free market alternative, I've come to the conclusion that this bill would simply further enable the implementation of the Federal Affordable Care Act, commonly known as Obamacare. I've worked hard to earn reputation in my short tenure to date for not simply saying no to legislation that fixes real problems. I've worked hard to provide alternative solutions, such as the case of Senate Bill 693. Our citizens do need access to affordable health care. Our state would have more jobs if we implemented a health care system that provided lower cost and higher quality care for our citizens rather than the citizens in other states. I regret to say that this bill does not provide an effective solution to these very real needs that is consistent with the free market principles that made us a great nation. I would like to have had time to submit a vetted substitute that would address the concerns myself and others who believe that the government should not establish a single exclusive marketplace for private health care plans, but the timeline pursued for this bill did not allow for such a proposal in the Senate. My alternative solution would rein in the scope of the quote-unquote exchange to focus on the determination of eligibility for government assistance to citizens and the definition of data exchange standards that would enable private exchanges to provide consumers with apples-to-apples comparisons of health policies. Instead, we have before us a bill that creates a Michigan health marketplace that performs quote-unquote all exchange duties in a bill with no definition of what an exchange is. It also performs a certification of private health care plans. It provides plan enrollment, plan purchasing, grants for navigators that threaten traditional insurance broker roles, and call centers to direct consumers to government ombudsmen. By serving as a middleman for financial transactions, I'm concerned that the exchange may actually increase insurance costs because of the potentially significant payment delay to insurance providers. In short, I have no confidence that this bill will yield a free market solution. The Michigan Health Marketplace would be a nonprofit organization that is a product of our state and federal government with overarching control of health system delivery within our state. A free market solution would focus this government organization on improving the effectiveness and efficiency of government programs such as Medicaid, Medicare, and VA services, and leave the comparison, enrollment, navigation, and purchase of private health insurance options to private vendors, including private exchanges. The majority of us were elected on the platform that featured fighting the Federal Affordable Care Act, commonly referred to as Obamacare. Make no mistake, colleagues, a yes vote on this bill as currently drafted is a yes vote to support Obamacare.